Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ria Tanwat-Cotrillo. Today on the program, higher projections from experts as the number of new COVID-19 cases doubled overnight. Authorities have tracked down the close contacts of the fourth Omicron case in the country. And a group of hospitals is holding off the so-called PhilHealth holiday. Infectious diseases specialist Doctor Rontgene Solante and Private Hospitals Association of the Philippines President Dr. Jose Rene De Grano join us live. A troubling COVID-19 trend just before the new year begins. Octa Research now projects 1,600 to 2,000 new cases nationwide today and more than 1,000 in Metro Manila. The new projections come as the country's new infections doubled overnight to 889 and amid the threat of the Omicron variant. Meantime, a group of hospitals is holding off its decision to stop accepting PhilHealth claims from January 1 to 5. Let's go straight to the source of this story. Infectious diseases specialist Dr. Rontgene Solante joins us. Now, Doctor, thank you so much for being here. As you know, the country logged 889 COVID-19 cases on Wednesday, and that is more than double compared to Tuesday's, which was 421. Where do you attribute the rise in cases? What is causing this?
Well, Ria, these cases of increase in number is expected when we are in this holiday season. We have more people going out, more people in high-risk areas, especially in enclosed spaces, more gatherings. And the fourth very important factor, we still have the virus with us, even with Delta, which is very transmissible, highly transmissible. These are expected. And what we do not like here is that if this will continue and we don't practice the health protocol, we continue to have gatherings, then chances are we will really have a continuous trend increases in cases in the coming days.
All right. I spoke to Octa Research fellow Guido David earlier this morning, and he was saying this dramatic increase, he believes, is not only due to the holiday, the holiday spirit and people gathering together. Could the sudden spike in cases be an indicator of Omicron community transmission in the country, even if it hasn't been detected yet?
Well, that's a good point. And for me, I don't discount that possibility that it can also be an Omicron variant driven. But let's take it first. When you look at Delta is also highly transmissible, okay? And that alone can really drive this number of cases. And you put in an Omicron variant, which is more transmissible, twice as that of Delta, then these are some signs that maybe we may have the Omicron variant. We also have the Delta variant. And that's why cases are going significantly very high in this particular trend that we are looking at and experiencing now.
Doctor, what should we monitor? What should we be paying attention to know if it is indeed Omicron that is now driving another COVID-19 surge, or if there's a community transmission of Omicron itself?
If we look at the experience with other countries who already had Omicron variant, it's the rapidity by which cases are increasing in a 24-hour interval. So meaning it's really the number of cases that we'll be looking at on a day-to-day basis. If there will be a rapid increase, drastic increase in the next few days, then most likely we are dealing with a highly transmissible variant, and that is Omicron.
All right. Everybody is so wary about Omicron, want to get as much information as we can about it, even if it is early days for this variant. Based on the latest studies you've seen, how infectious is the Omicron? You've already mentioned it is much more than Delta. But what about its severity? Are we likely to see hospitalizations increase?
Yes. For now, Ria, there are there are red flags of this particular variant of concern compared to the Delta variant. One, not only because of its high transmissibility, but also of its ability to evade our immune system, especially for those who are immunocompromised, or even those who are vaccinated, that we can still get the infection. Okay, but the other side there is that even if you get the infection based on the current data, the risk of being hospitalized, the risk of getting the more severe form, vaccine can still work, especially for those who who still have especially those who have been boosted. And I think this is something that we need to monitor also, because this is the data coming from abroad. And the question then is that does this data will be is applicable to our setting? If once Omicron is here, will we still be having more milder or mild symptoms compared to severe cases? For me, even if you have mild cases or moderate cases, there's still a potential that it can overwhelm our healthcare facility, and we really have to be proactive on this. That we need to protect ourselves. We need to strengthen our health protocol in order not to get this virus.
Right. Do we have enough measures against Omicron? Does the government need to calibrate the COVID-19 response at this point as we prepare for Omicron to become more, to see more Omicron cases here in the Philippines?
One very important step that we're doing now is to really enhance more our vaccination. More people that will be vaccinated, even with the primary vaccine series, will be protected against the virus, especially development of severe infection. Booster for those vulnerable population. And the other very important part there is also the diligence to be complying with the health protocol whenever there is a need to do it. And more or less, we encourage everyone not to conduct unwanted gatherings.
Right. And of course, testing is key. We see a lot of people getting tested before gatherings, before travel, and all of that. However, the US FDA has warned that antigen tests may be less effective in detecting Omicron. What do we know about this, and how concerning is it?
Well, the way we're looking at testing is still an important part of the detection. And for now, our recommendation is still doing an RT-PCR, which still is able to detect even an Omicron variant. No, and I think, Ria, we need to emphasize this, that even if you have mild symptoms, it doesn't mean that you can be complacent about it. It can be due to any respiratory viruses, but in the event that we still are in the pandemic, we need to isolate ourselves. Okay, we need to access testing so that we should know if those mild symptoms are really because of an Omicron variant or a Delta variant, and so that appropriate contact tracing within the family or those with contacts of that with mild symptoms can be emphasized.
Right, absolutely. Because even if you have mild symptoms, you could very easily pass it on to somebody who would not have mild symptoms and God forbid, have a more severe illness because of it, right?
Yes, correct. And I think we need to still remind everyone, okay? You cannot just be complacent about your symptoms, because you don't know. The person next to you are the vulnerable population. And we know that vulnerable population are more or less likely to develop the more severe infection.
All right. Speaking of protecting the population, the government will decide on the new alert level status. The current one expires tomorrow, December 31. Would you prefer status quo? Is it okay to downgrade, or with this surge, do you think it's time to tighten restrictions?
I think for me, we should still maintain the alert level 2, and with more awareness to really follow the health protocol, because for me, it's the behavior of people now during this holiday that will determine our vulnerability in getting the infection.
Now, doctor, there's a suggestion to administer a 4th dose of COVID-19 vaccines amid this Omicron threat. What are your thoughts on this?
Okay, so let's take this. There are emerging data, and even with the Delta before, that your neutralizing antibody may not be enough, no, to protect you against the infection, but your T cell response is there to protect you against the more severe disease. And the experience now in UK, wherein most of those that were infected only have mild disease, are fully vaccinated, this only attests that if you're fully vaccinated, your body can still respond and protect you against the more severe infection. Although not against getting the infection, still have that infection. But for me, we need to study yet, no, if a fourth dose is really needed. If a fourth dose is needed, I don't think this will be for the general population. And I would say this will be for the severely immunocompromised population, where the response with the vaccine may not be as good as that compared to the general population.
All right. Another question for you, Doctor. Do you think the government should require the use of face shields once again amid the Omicron threat, or it wouldn't make that much of a difference?
I think for me, even up to now, I'm wearing face shield even when I go to the public. No, and since the government has mandated that it's optional, we should remind everyone that being optional, it's your option now. It's an option to use the face shield. But again, face shield and face mask are two important layers of protection that hopefully and can also protect us from this Omicron variant.
All right, Doctor, again, from the studies and the information that we have about Omicron, are there any particular vaccine brands that are seen to be more effective against Omicron over others? And should the government veer away from brands that are seen to be less effective against Omicron?
There are limited data on other vaccines, no? Like, for example, with the Sinovac, no? And limited data doesn't mean that they're not effective, okay? Again, we have to understand, no, that the way vaccines are work doesn't also mean that all of this will work more or less have the same capacity to produce an antibody. But all of this vaccine can still protect us in a way that there are those with a higher neutralizing antibody, those with a lower neutralizing antibody, but still the US still have that protection. And all of this vaccine can still have a very good protection against developing severe disease. So, I mean, at this point in time, as long as you're vaccinated, any recommendation coming from the government, any vaccines that is available, I think it will still work with Omicron variant, especially with the booster doses.
All right, Dr. Rontgene Solante, thank you very much. We will be taking a short break. When we return, a group of hospitals holds off the so-called PhilHealth holiday. We'll speak to Private Hospitals Association of the Philippines President, Dr. Jose Rene De Grano, live. Stay tuned.